The nation's top infectious disease doctor says there is a drug trial going on that shows that a drug involved in this can help COVID-19 patients recover.
That the data shows that Remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
Dr. Anthony Fauci says on average, Remdesivir reduced a patient's recovery time from 15 days down to 11 days in the hospital. We've learned trials of this drug have been going on in Colorado for longer than a month. So we wondered, how does Remdesivir work? Well, that is a good question. I spoke with a man who was part of a drug trial here in Colorado.
Were you fearful in the hospital?
I was, to be honest.
Juan Rivera is home in Commerce City after 11 days at UC Health University of Colorado Hospital facing down the coronavirus. Soon after he got there 2 weeks ago, they asked if he'd like to be part of a drug trial. It would be for Remdesivir, made by Gilead Pharmaceutical. At first, he didn't notice much, but then...
Was there a day or a point at which you thought, hey, I'm getting better?
Probably like midway through my stay at the hospital, I felt comfortable. I could get up.
The hospital is one of two we've learned of with Remdesivir trials in Colorado. The other is Denver Health.
Do you think the drug's working?
I think so. All early indications are that it is, and we need more data. But
Dr. Connie Price, Chief Medical Officer at Denver Health Medical Center, explained its function.
it prevents the virus from getting into the cell and replicating.
Coronaviruses use long chains of RNA to replicate in our bodies. What Remdesivir does is it convinces the virus to put a substitute link in that chain. Then, when it tries to add to that chain, it cannot attach, a process necessary to make more viruses. As the virus was knocked back, Juan found himself getting stronger.
As days were going on, I could stand up, I can walk around, I can, have some movement. And so I think it did help because, it made my stay, short.
Now that he's home, he's glad he played a part.
Being able to help myself, but at the same time, be able to be at a trial that's going to help other people.
Do you think the drug helped you?
I think so.
That is your good question. Dr. Fauci said he is obligated to let people who have been getting a placebo know so they can have access to Remdesivir in other trials that are going on. That's how big this is. Send us your good questions, and you can always email us at goodquestion@cbsdenver.com, or you can post them to social media with the hashtag #4goodquestion.